My name is Dr. Sean Price, Clinical Coordinator here at The Fix, and I'm shooting this video series on getting back to the basics in health because our body is designed to heal. Our body is designed to do what it's supposed to do. Now, let me clarify, there is a time and a place for medication, okay? And I'm thankful for medication at times. For example, my wife has asthma. She does not take her inhaler very often, but when she does need it, I'm thankful that she has that albuterol because it helps her breathe, okay? And I have not been able to resolve that asthma with her. That's one condition I'm still working on. Sometimes, if you have an acute situation, there's no system better than the medical system to override the body and get you through a crisis. It's a beautiful thing. If you are in a health crisis, life or death, or something that could turn into life or death, and there's a medication that can help you, please take it. Follow your doctor's advice. But when you're getting into trying to rebuild your health, you're trying to recover from chronic conditions, medication does not heal the body. Medication does not rebuild the body. Medication is designed to get you through a crisis. Okay, we have the best crisis care system in the world. We don't have the best healthcare system in the world. And I want you to understand that. So, are we actually getting healthier due to science? You know, going through an acute situation where there's something that could be life-threatening? Yes, absolutely. I break a bone, take me to the doctor, let them set it. Don't come to me. If you have some kind of a chronic condition, or not a chronic condition, an acute condition that is life-threatening, go get the medication, get through it, but then come and heal your body, okay? Because the fact of the matter is, if you look at the statistics, everybody thinks that we're living longer and we're living longer. Now, I don't have the exact numbers for this, but the fact is we're not living longer. What's happening is these lifespan charts are not taking into account the high death rate back in the days before, sterile hospitals and birthing centers to help children get through the birthing aspect. So infant death at the birth time. They're not taking into account the high rate that used to happen of infants dying at birth into that lifespan. So that has gone down, and I'm going to go into that in the next video, or here in a minute. That has actually gone down versus 1800s, 1900s, things like that. So it takes our lifespan and actually increases it artificially. But we have more and more people now dying at the age of 40 and 50 years old of heart attacks, of cancer, diabetes complications, things like that. So it's not that we're really living longer, it's just that more of us are surviving at that early age. So science, it helps us get through these acute situations, but it's not necessarily helping us to live longer. And even those who are living, into their 70s and 80s, it's very rare that you find somebody that's truly healthy. They're usually on 5, 10, 15 medications. They're going through all these side effects. They're pretty miserable, okay? And we're working with those patients trying to get them off of it. And a lot of times when you have patients coming off those medications, their quality of life improves dramatically. So I propose that science is not necessarily helping us live longer and more vital lives. It may be helping us to increase the statistics, but our stats and our quality of life are not necessarily there. Now, I mentioned a little bit ago how we've cut down on the infant death rate based on the 1800s and so on. This is true. There's a lot less infection. There's a lot of life-saving technologies that can happen in the birthing process. However, I just heard a stat about 3 weeks ago that the United States ranked last in infant death rate and last in infant survival and mother survival in all of the industrialized countries. I believe that's because we are over-sciencing the situation. Babies are coming out, they're immediately given an ointment in their eyes, they're immediately vaccinated, they're immediately vitamin K shots, they're immediately doing all these things to override this precious new body that just came into the world. I had to battle tooth and nail with my 4 kids to get them through that process without any of that happening to them, because they want to do that to them, and I feel that that's detrimental. So again, sterilization, sterile environments, life-saving techniques for emergencies in the birthing process have decreased the death rate, but as far as like infants surviving longer, they've gone too far in the other directions. They're doing too much when babies are born. That's my opinion. So anyway, I don't think we're healthier due to science. I think it's great for acute, life-threatening situations, but as far as rebuilding health and maintaining a quality of life, medicine does not do that, okay? And I know this is going to cause some controversy, but again, get back to the basics, rebuild your body, eat a whole food diet, exercise every day, make sure you rest, make sure you have a positive mental attitude and keep your nervous system functioning, and you're going to be fine.